Okay, so thank you so much, my friends, for joining me for today's session. We are going to look into the integration of artificial intelligence in research principles and methods. Why we are talking about this topic? That's because nowadays, when you are going to work in any company or in any institution, in any government as well, we are using AI. AI not just being a ChatGPT or any other of those AI applications where you can just manipulate pictures or movies, but also any component that is using artificial intelligence in any system. So we are using algorithms within that are embedded into systems, and they are now going to allow us to do specific tasks, specific jobs, such as, for example, going over a trend analysis, writing a research hypothesis, reviewing the statistics for a data set. So each of and every of these different activities can be done through the use of algorithms that are being used by artificial intelligence, I would say programs or just codes. So the course here is delving with the exploration of how artificial intelligence can be integrated into research principles and of course methods as well. So we are going to go over the research methods and research principles, and we are also going to look into different components of research methods and where we can use artificial intelligence. So this is just a type of research. So we have about six most critical types of research. We can talk about exploratory research, where we are exploring. We don't know that much about a topic, but we would like to explore, and it's possible that during the exploration we are also going to have other questions in our research, and we would like now to test, I would say, to question and then to work on the question and then to test our hypothesis. So this is just to explore. We also have a research where we are going to describe what we are seeing. So here we are looking into just the description, and we call that again descriptive statistics. And we are going to look into, I would say, the evolution of a disease. For example, you're looking into the change in the customer's satisfaction level. We are going to look into evolution of a price in a stock, okay, in a stock market. So we can have several types of research, and we are going just to be able to do the descriptive statistics. We can also have explanatory research, where that research is going to explain a phenomenon, explain some type of trend that we were able to see and we wanted to know more, so we did dig more down into again research, into research questions. We use several tools in order to conduct research just to be able to explain that. We can also have correlational research, where we are looking into one phenomenon with another one, with or several other trends, and we are going to look into those trends over time. For example, we would like to know the level of satisfaction of people taking a vitamin based on their age. So as you see, there is an evolution in age, and you also have an evolution in the rate of satisfaction of people taking a vitamin. So this is a correlation that we are looking at. We can of course look into other types of correlation, and again, this is constituting a type of research. We also have causal research, meaning that we do have a phenomenon, we do have some topic that is affecting another phenomenon. We have a variable that is affecting another variable, and we would like to know more about how those variables may again affect each other. For example, and this is a very interesting topic of research as well, you know that we have mental health and we have physical health. We can now conduct research in order to look into the general effect of mental health on our physical health, and of course to look into the effects of our physical health on our mental health. So this is where we can talk about causal research. We can also do experimental research, where we are going to look into the effect of a drug, looking into the effect of an intervention, looking into the effect of, I would say, a new mortgage rate, looking into I would say on the customer satisfaction. We are going to look into the effect of a new interest rate, for example, on the inflation rate. Okay, these are all different types of experimental research that we can conduct. Now, we also have types of research methods. We are going to look into how and what methodologies we are going to use in order to conduct research, because when we are going to look into research, we are going to get data. And the data is going to be, I don't know, 5 million data that we're going to have. Of course, they're going to be classified, they're going to be categorized, but still we need to have tools in order to describe I would say the data, to show, of course, if there is any correlation, if there is any causality, if there is any relationship in between groups. And this is where we are talking about the research methods, because we are dealing with a big number of data and we would like to do the analysis. But for doing the analysis, we will need to have methods to perform the data analysis. So one of the research methods is descriptive research, where, as I already mentioned, we can describe the results, research first, describe the results, and then to talk about different tendencies, different trends that we may see just by observing. And this is where we can, for example, calculate the mean plus the standard deviation, and then to look into the mean and standard deviation over years, over months, for example, and looking into the evolution of a variable that we are looking at. It can be a tumor size, it can be again a stock market, we'll say the price of a stock. It can be again the level of customer satisfaction. Okay, I'm using always the same example so that it's going to be much more understandable for everyone. And then we also have analytical research. Analytical research because we are doing analysis. We look into the trends again. We look into the evolution of something, and we are going to a variable or several variables, and we are now going to follow that over time, and we are going to be able to explain the I would say the change in the variability. So the measure of the variability, and we'll be able to explain, of course, those variabilities as much as we can. And of course, based on research, based on the tests that we are going to do, based on questions that we may ask from our customers, for example, to understand why we are having, for example, a higher rate of customer satisfaction over years with the same product. And we are going to ask questions, and we are going to understand. And obviously, ultimately, results of the research is going to allow us to I would say increase the quality and mainly to improve a system or a product. This is why we do research. We also have applied research where we are really applying. And now we're going to change something, change a variable. We are going to give a new variable, like a drug. We are going to look into some interventions. Okay, it may be a police intervention. It may be a health care related intervention. It may be, again, a type of intervention with the stock market. Okay, so they're all different interventions. And we can now, of course, look into the change that has been made, and then to do research in order to understand the consequences of those changes that are made in several variables. Okay, so if you are dealing with banks and financial system, we are maybe increasing the interest rate, and then we are going to see that interest rate are going higher. Hence, we have mortgage rates that are going to be higher. Hence, we are going to increase again the level of the inflation. So it's like increasing inflation, and then increasing the again interest rate, and then interest rates are going to cause again the mortgages rates to go higher, and then we are going to contribute into increasing the inflation rate. So this is an applied research, understanding the consequences of those interventions. And again, we can find so many other interesting, very interesting examples as well. Another type of research method is fundamental research, where we can talk about basic research. But basic doesn't mean that this is out of the of any importance. No, it means that this is fundamental. We need fundamental research in order to understand or to build up on our research methodologies. For example, in biology, in microbiology, for example, or biochemistry, We are doing fundamental research, learning about how cells work, how enzymes work, how drugs are affecting those enzymes. Now, what is the effect of those enzymes in the physiology of the cell? And now, what is the effect of the cell in the overall physiology of the organ, which is part of the body, so that we are going to now understand, based on the fundamental research, that if we know more about an enzyme, about its activation, about its inhibition, and about knowing about any other type of I would say channels, or I would say again, I talk about enzymes, or anyway any type of I would say any component in the cell. We are going to look into, okay, now that we know about the fundamental research and we know about how these components are working, hence we can now look into testing our drugs and looking into I would say determining or predicting the effect of a drug. We can also talk about quantitative research, where we are dealing with quantity, with a number. This is a realistic or objective numbers, where we can also use statistical tests in order to compare two populations, three populations, and we are going to be able to look into the effect of the intervention and to show that the effect that we are seeing is not just because of an accident, and in fact, we have a high percentage rate of I would say, acceptability of our hypothesis. We can also talk about the qualitative research, where we are looking into suggestive data, as opposed to quantitative, where it's a number like the blood glucose level. That's a number. Qualitative research is your level of happiness, where it's not very easy to give a specific number, where we are going to set metrics, but still I might ask you, okay, what is your level of happiness on a scale of 0 to 10? But still we always have some bias in the data, because we have people with different personalities, of course, or dominant personalities, and for them, when they are going to express their level of feeling when they are happy, it may still, I would say, be recorded as something which is biased. So maybe someone who is happy on a scale of 0 to 10, I would say 8, maybe for the person, this is the maximum attainable level of happiness. But for someone else is 10. But when we do our statistical tests, obviously we may have some bias in the information, because in the results, because it has not been recorded properly, since the evaluation of the level of happiness, which is qualitative and suggestive, is different in between people. We can also talk about conceptual research, where we are looking into research, doing research for the concepts. So these are not, as opposed to empirical research, where we are looking into the observations. Conceptual research is not relying on the observations, but we are testing. It's like an exploration of the concepts. Now, let's go over how to integrate artificial intelligence in research principles. So when we are talking about research activities, in order to look into variables and finding out some relationship or understanding how things work, and then of course to come up with solutions in order to improve any system or product, this is why we do research. And then the research must be careful, diligent, and exhaustive. It must, of course, discover new facts that we can use. It should revise accepted conclusions, theories, or laws. It may gain solutions to problems. It may discover specific answers to specific questions, and done in a reliable, objective, and organized way. So for the methodology, as we already talked, we have research methodologies where we are solving problems through research. And for the scientific method, this is a discovery by systematic investigation in a formal process, and it develops or contributes to generalized knowledge, and it uses rigorous observations, analysis, and reasoning. Now we have pure research, where this is an abstract or and general, and it's seeking to generate knowledge for knowledge's sake. So this is exploration. We also have applied research where we are looking into answers to a practical question. So we look into also empirical research where this is based on observations, but observations of again the effect, or we say consequences of what we have tested, and this we did that through intervention. So applied research requires intervention. Now we have experimental research that uses variables, controls, and randomizations, meaning that we are going to, by hazard, choose our, again, I would say human subjects, if this is a clinical research case. We also have descriptive research, where this is a description of individuals, groups, or situations. We just describe, we don't use any statistical test. And this is a mean to apply a knowledge gained when we are looking into, I would say, a phenomenon or a research, I would say, topic. Now, for clinical research, it's performed in the real world with clinical subjects, and it's a control over a variable that may be difficult, because when we are going to, again, give a drug, for example, or an intervention that we would like to do in people, we cannot always be sure about whether or not the drug is going to be used properly, within the timelines, or the, I would say, the even within the dose that we are asking the person to take. Sometimes people may forget a dose, sometimes they may take two, sometimes they go for vacation and they may even leave their drugs because they are in vacation. Sometimes they are taking a drug with another drug and we don't know exactly what is the drug-drug interaction. Even with the food and drug, we may have some food and drugs interactions as well. So there are so many different biases. So these are variables, and the control is not very easy. And of course, we have laboratory research, where the research is performed in lab, and this is again under tight controls. Now, talking about the qualitative research, this relies on generating descriptive theory from data. And of course, here we have investigators who develop hypotheses. And the features are, for example, phenomenological perspective, and we now talk about the data obtained in context that has potential to reveal complexity. It operates without standardized instruments, and much study analysis is performed using words. Okay, now continuing with, again, the research methods, we can talk about the quantitative, so quantity with numbers, we talk about objective numbers. Research, where we have the methodology that relies on testing theories to establish facts. And of course, we can talk about experiments, structure surveys, interviews, and observations. And here we look into variables, different variables like I would say age, gender, level of happiness, for example, level of instruction. Anyway, these are all different types of examples of those variables as well. And we can also have some controls. For example, if you are looking into the effect of a drug, you may have a group where, again, your group, one group is going to be exposed to your drug, and another group is exposed to a placebo or to your competitor's drug, and you are going to have a control here where you would like to compare your drug effects with another drug, or you would like to, again, we can go to the financial or marketing or business as well, where you can have an intervention. You may have a promotion for a product where you promote a product and you would like to look into a control for looking into your for example, your product or your promotion is to look into the effect of a similar promotion for a similar product done by or offered by your competitor, and then you are going to be able to have a control to compare your efforts or your I would say results, compare them with no intervention or intervention by one of your competitors. So whatever I'm talking here is not just research in clinical or in animal or in microbiology. It is talking about research principles, and we are looking into research principles in all of the fields. Of course, another interesting and important I would say point that we have to talk about is randomization. This means that we don't choose our subjects. what is interesting and what is preventing us from having bias in our research results is to have randomization or choosing randomly or so by hazard our topics, our subjects. Even in clinical trials, testing a drug, for example, we do have randomization studies as well, randomized studies where we are going to randomly select patients. When you do research in a bank, again, an IT company, in research in the manufacturing, for example, the same thing applies. We are going to randomly, so by hazard, select some equipments, select some services, select some teams, and then we are going to do research in order to look into their, I would say, their benefit. They're going to look into their performance. Now, for the study types, we have trials or clinical trials. This is where we assess differences between two populations. Many of those studies, if this is related to regulated environments, they need approval from regulatory authorities. And any trial that you are doing, even if it may not require approval from regulatory authorities, because it's not in regulated industry, still, if you are dealing with human subjects, you will need to have the approval from an ethics board, because as long as you are using or including humans in your studies, you have to have the IRBs. Now, it can, of course, have a therapeutic, I would say, use. Then we have treatment protocols. It may be a prophylactic or a prevention. Then we are going to have a methods of disease prevention. Now, regarding the control trials, we already talked about the use of randomization. We also talk about the biases, of course, that are the basis of drawing, biases that are, I would say, has to be prevented in order to be able to have correct and real basis for drawing scientific conclusion. And of course, we always have variations that exist in control trials. We can have placebos. We can have masked studies where the experimentator doesn't know if the patient, for example, is taking a drug or a placebo, or what drug or what dose they are taking. It may be double blinded or double masked. It means that neither the investigator nor the patient know about what they are taking. And this is where we talk about double mask, and this is again for removing a bias as much as we can. Now, we can also look into observational studies where these are clinical trials without randomization. You just observe and you are not choosing by hazard or randomly your I would say research subjects. And this is based on observation rather than experimentation. And it's not used, of course, to draw scientific conclusions. However, when we are using descriptive statistics and we are going to use observational studies, those data can contribute into, again, I would say, reviewing the research question and the research hypothesis in a research. And then those observational studies, they provide strength of evidence of additional experiments, because as I told you, when we are doing an exploration, we would like to know more. When we are doing fundamental research, we would like to continue in order to learn more about the cascades of events and intracellular pathways that are being affected by a drug, for example, in order to know more about what happens. Same thing applies to, again, I gave you examples, banking sector, other industries as well, financial, marketing, sales as well. We need to do observational studies, and based on the observations, we will be able to, I would say, predetermine sometimes some actions. We may also look into, again, we may make some, I would say, assumptions on the next steps, or how the market is going to react, how the market is going to react to, again, a financial decision, for example. And of course, we have cohort studies. These are, again, as a type of observational study. It follows two or more groups in a population. It focuses on a risk factor. And of course, groups may be, again, controlled. So they may or they may not have been exposed to the risk factor. And they may, of course, be prospective or retrospective, meaning that we are going to look into the past, I would say, data, or we are going to observe and we are going to be retrospective. We are going to look into the future as well. So as you see, when we are doing some research, we don't just look into the present time. We may look into the past results as well and use them in our analysis. We can also look into the next 2, 3, 5, 10 years of research in order to continue to do the exploration, to do the fundamental research, to look into a phenomenon, changing a variable, effect of a new decision, etc., etc. Now, we also have case control studies. These are type of observational studies. They focus on the event to be studied, not to the risk factor. So we have two groups involved, person with a disease, for example, being studied, or person without a disease. Now, if you would like to apply that to other industries, it's going to be a person with, again, a particular variable and a person without a particular variable. And now those variables, they may be different interventions. And again, those interventions will depend on the industry where you are. We also have, of course, surveys. We use surveys because if you don't dispose of enough data, or this is a new topic, a new research topic, it's a new, even I would say, research in a new country, on a new drug, on a new, I would say, idea. If we don't have the data, or if we would like to have a current data on a specific population as of now, we are going to go over survey research, and this is where we are going to look into collection of the facts, figures, or opinions. And this is taken from individuals or groups. We also have social and behavioral research, and they deal with human attitudes, beliefs, and behaviors. And they use questionnaires, interviews, focus groups, and direct observation. So again, why we perform research? That's because we would like to study something, explore something. We would like to know what will be the next steps related to an observation that we are making now. What would be the future of, for example, the safety profile of a drug which is on the market? What will be the future of the sales, the trend of the sales of a food on the market, of a vitamin on the market, okay? And again, these are different interventions that we can always look at by conducting research. Now, we can also have outcomes research. So these are evidence-based research. We look at the evidence, so it must be empirical. And of course, this developed in response to high cost of healthcare, and it has been embraced by federal, provincial, and municipal governments. Okay, so overall, we went over research principles and research methodologies, and you understood now very well why we do research, what are the different types of research, and why we are using different types of research, and at the end, what we would like to achieve. Now, let's go over the role or integration of artificial intelligence that has algorithms embedded into a program. Now, it can be a standalone AI program. It can be an artificial intelligence module that is integrated into an existing system. So here, we can always use as the first step of study design, which is, as you can see on the left side, we can talk about identify the topic and do literature review. So we can easily use artificial intelligence in order to prepare a list of all of the literatures that we need to review. We also have applications for AI where the AI is going to just upload the PDF file, or you give the URL of the PDF file or the article, and the AI is going to give you a brief of that content. Can also explain this to you. You can also ask AI to create graphs or charts based on some data that is already published in an article, or you can also even yourself use your data and again give it to AI in order to look into, again, the tendencies and then to identify a topic. So we can use AI in order to create not a research question because it comes from us, but to fine-tune, to review, to revise a research question. We can also ask artificial intelligence to create a research hypothesis. We can always, of course, go over that because we don't use AI in order to think for us or work at our place. We want this to accelerate our search, accelerate our literature search, going over different databases, and even now as an assistant, we can ask it to give us a tabulated summary of 10 different research articles. And we can use those after checking them for their integrity and their validity. We are going to use them, of course, in our literature review section in the article. We can also question artificial intelligence with the study rationale, because it's important that we have a research question and then to write the study rationale or the reason why we are doing the study. However, writing this with a correct grammar, making sure that it sounds scientific and it is really clear in English or in any other language, and of course even to compare the study rationale with existing study rationales, because maybe we did miss by inadvertence, again, a type of research point. This is what AI can do. So again, we use it as I would say, as a tool in order to help us as an assistant. Assistant can make errors. An assistant may be limited as well, but an assistant which is fast. So if this is fast, it allows us just to work faster. Of course, it takes time for us to work, to get to, or to learn more and to work faster, but it's going to definitely reduce the amount of the time that we need in order to just reiterate in our mind and then to search again on search engines and then to have access to some I would say some documents or some resources that are not are valid. However, with AI, as you all know, we can now buy AI for an institution, meaning that only people from the institution using their email can access an artificial intelligence module or application, and then that AI is going to be is already exposed to the information that the company or the institution wants the employees to have access to. And we are going to see more and more of AI modules where, and again, already now we have it. You can also, again, create an AI just on your computer, just for going over your own files. You can limit access of AI to the information. You can just feed AI with the information that you want to do that. This is what chatbots in the past were also being able to do, but now with AI, we are having much faster processors. We are having, again, different programming languages that are much more, I would say, adequate, and they can really, they're executing fast and they have more functionalities, for example. So the idea has been there for years, but now we are having those fast processors, fast computers, and of course better algorithms, and this is why we can definitely use AI as an assistant. We can also look into developing hypotheses. Again, you will develop hypotheses from your research question, but nothing can prevent you from testing the hypothesis with an artificial intelligence, again, program that has been exposed to the same information that you have been exposed to. And again, I told you, you may be on a public domain, you may also be in a private domain with limited access to some information. So we will just look into developing hypotheses based on, for example, 10 articles. We say to the AI that you just take into account these 10 articles I'm going to give you a research hypothesis. You are going to compare my research hypothesis and tell me about if this is a good one, if it can be improved, if it has been already addressed, if we should even make it more broader or more focused. Then we can look into methods used in research. Are we going to use any of the methods that I already explained in the previous slides? Yes or no? Are we going to have other research methods? AI here can easily compare your research methods with existing studies using similar patients, similar type of interaction between variables, similar, not identical, of course, hypotheses, and it can give you examples of other methods used as well. You can also have a set of data and you just add the data, you paste it in a AI interface, and then you're going to write down that this is a data from a clinical trial, for example, with patients between this age and this age. They have been exposed to this drug, and what you're seeing here is just, for example, the systolic blood pressure before the intervention and after the intervention. And then you're going to ask the AI to come up with the best way that you can do your statistical analysis. It will obviously going to tell you that you have to do a paired t-test if you have the same number of, again, observations in both groups. And then, if you want, it can also ask AI to perform that t-test. So why not using it? And this is exactly the next point with statistical analysis and results. You can use AI for statistical analysis results. You can also do your statistics and then to double check that with AI. Of course, you may say that in order to use AI, we need to have more validation, we need to have more regulations. You are right. However, companies already started for more than a year to work on AI, to fine-tune that, to have internal AI. So like internet and intranet that we have in each company, where intranet is the internal internet with no, or maybe just one gateway to internet, the same thing can apply to inter artificial intelligence for everything, and intra artificial intelligence within a company or within the servers or the documents or document management system of the company. So this is where we are. Now, based on the observations, analysis, and again, I can tell you also that if you are using softwares, simple one like R Studio, you can also go to the R Studio, I would say go to, again, an AI chat like u.com or ChatGPT or Copilot or any other else. And then you're going to say, look, that's my data, write a script for me in order to run it in R Studio. So what it will do is it's going to write a script for you. You can now take this script and you go to an R Studio online. No need to have it, installed on your computer. And then you're going to execute it, and then you're going to have the results of your statistical data. This is also one way that you can use AI in order to generate scripts that will be used in other applications such as R Studio in order to conduct your statistical test. So you can also look into what formulation you can use in Excel. You can also ask again the AI to let you know what scripts you are going to use in other statistical programs as well. So you see that we are using AI almost everywhere. And the last but not the least is about the conclusion and discussions. We are not asking you to ask AI to do the conclusion or discussions, but we can write our conclusion and discussions based on each and every graph or table or intervention and results in the research, and then we will be able even to again ask or write the conclusion, give it to the AI, and then to ask AI to revise it for us for just the grammar, for just again more than grammar, for also going over some data. Maybe we did miss something. I'm not saying that AI knows much more than us, because it doesn't understand, but it does look into algorithms, into the relationships in between the terminologies that we are using, and it's going to, of course, look into the structure of how we write it, but also we can do the calculations and can now apply, I would say, its abilities to, I don't want to say understand, but to use the data in order to integrate them in a proper way in a text. Or you can give it a data and it's going to integrate that in a very good way, good manner, applicable and acceptable manner into a summary, a tabulated summary, so a summary in a table. So these are different ways that we can, again, go through the integration of AI. Now, another word about the institutional review boards. Review boards are ethics boards, and when you're having again, human subjects in your study, you will need to write, I would say, applications, talk about your protocol, and then to send your requirements or application to the IRB or institutional review board, and then, of course, to get authorization. So we can use AI in order to fine-tune, review again the English, the grammar, as well as just creating tables, writing about the risk, about possible risks. So we can use AI as our assistant in order to give us some ideas in order to write. And of course, to correct as well the way that we write. But don't forget, again, we have to proofread everything. And don't forget, again, another point is that AI is working on your own ideas, so there's no issue with you looking into other people's ideas. No, AI is going to review your text. It's also going to, can give you the best way to write it in English as well. And no, don't forget that if you are using the AI by using your institutional, I would say, AI interface, by using your email address to get into the AI interface and then to use confidential data, your data will stay confidential. Okay, so I'm not again telling you to go to ChatGPT or Copilot or U.com or Perplexity or anywhere else, just anonymously or just with your personal email. For those among you who are working for an institution, institutions have usually a secured, I would say, interface on AI. You just need to use your own institutional email and then to get into your own protected, I would say, AI environment. Now, what institutional review boards they do? They look into the research protocol. This is what we can also do by looking into artificial intelligence for going over not just the grammar or typos, but also looking into different visits that we write in a protocol. In a protocol, we do have a section for the rationale. We have sections for explaining the outcomes, study outcomes, and then we have also, again, sections about the pharmacology, about the information about the drug as well as looking into different, I would say, visits or study visits. But what is also interesting is that we can also choose the best patients that we can use in our study for testing the efficacy and safety of a drug, for example. Or it's not just, again, a drug, it can also be using human subjects in order to go over a survey, looking into their opinion or their feeling about, again, a mortgage rate. Okay, I'm giving you an example. In this case, we'll be able, again, to use AI. And again, AI is giving us ideas, giving us also maybe better ideas in order to protect the population as well. So we can review the inclusion and exclusion criteria in any protocol as well. And we can use it using AI. And don't forget, again, we always proofread. So we have an assistant called AI who is helping us doing things fast, doing this not always accurately, but as much as we can expect AI to do. We know that it's also safe if we are within the, I would say, the institutional environment, and then we can also decide what type of information or what documents the AI can access, because we don't want AI to go over I would say 3 million different articles, and then to come up with some solutions or some propositions that are completely confusing. Okay, it may. So we can also control this at that level. Now, for the research protocol again, what IRB is going to do is to identify risks and weigh against anticipated benefits in the study. They review recruitment and selection of subjects, qualifications of investigators, confidentiality protections, and of course they look into the conflict of interest. These are also several topics that we can examine using artificial intelligence. We can look into the risks, the weighting against anticipated benefits. We can look into the recruitment and selection of subjects. Again, we can go over each and every of these topics that I'm talking about here. But don't forget, again, we proofread, we review, we always use, again, the results of an AI work with a grain of salt, because it's helpful, it's good for statistics, it's good for, I would say, reviewing for the grammar, for going over some evaluation of the text, adding some information, but still we need to review that and proofread it. Now we can also look into determining human health problems. Here, for example, we can look into again what we call epidemiology, which is the study of how and why diseases occur. We also have epidemiologists. They are scientists who engage in research and investigation, and they use AI and high-tech computers, softwares, and labs, and they look into outbreaks of diseases today and in the past. And they can also do predictions of the evolution of diseases, of signs and symptoms, and number of people who are going to contract a disease in the future based on algorithms that are being made by different softwares. Nowadays, we added the artificial intelligence algorithms over the existing softwares as well, or functions. So what I can tell you is that here AI didn't create something new, because we already had those type of softwares or functionalities, but AI again added an additional support, additional level of quality and review and revision, of course, that can be very helpful and useful. So now talking about the epidemiological basics, we talk about who is being studied, concept of risk identification, sources of data, and of course main focus on epidemiology, nature of disease, different types of epidemiological investigation. And here we can again see that AI can help us to review and propose, of course, information or new information. Same thing applies to prevention of diseases. We can look into primary preventions, secondary preventions, and again we can count on AI in order to look into the trends in the past based on what is in the libraries or in the articles, and to come up with a table or a trend, and then to propose to us some type of trend that may be the one that is going to allow us to predict how, again, some diseases may progress. And of course, it allows us to do what we call a tertiary prevention, so focusing on persons in advanced state of disease, and it will allow us now to again do predictions and then to do some preventions and preventive measures as well. Now, based on the basics again, we are talking about the epidemiological basics. Here, agents that cause disease can be physical, chemical, nutritional, biological, genetic, psychological, and the hosts are living beings. So again here, artificial intelligence has the ability to look into, to do a multifactorial analysis specific to a disease or to an environment, and then to come up with a table in order to give us an epidemiological basics and agents related or relevant to a disease that we are looking at, with different types of preventive measures, with again within the environment that you're looking at. So it's very, very useful as well. And of course, for the environment, AI can allow us to look into analyzing the physical, biological, social, economic, or geographic, I would say, variables or influence on the results that we get from the epidemiological studies. And for types of epidemiology, like research, we have descriptive epidemiology, analytical epidemiology, and experimental epidemiology. So this is again where we can count on the use of AI in order to assist us to go over different types of investigation, description of diseases, looking into the frequency of occurrence, going over the tables, existing ones, going over existing trends that are already published, and allowing us to, of course, have ideas, getting ideas, learning from the past, learning about the actual results now, and of course to prevent harm by using AI in epidemiology. And of course, in summary, AI is revolutionizing various aspects of fundamental research, healthcare systems, clinical research, big data analysis and analytics, and epidemiology. So, moreover, AI ability to analyze vast data sets is in transforming the healthcare system by identifying research patterns, accelerating drug discovery, and facilitating precision medicine initiatives. And overall, the integration of AI in healthcare, research, analysis of data, and epidemiology is driving unprecedented advancements, enhancing decision making, and ultimately contributing to the improvement to public health on a global scale. So thank you so very much for your attendance, and I hope that you enjoyed today's lecture. Thank you.